Hi everyone, Nurse Cat Pink coming to you to talk about IUDs today. I'm a lactation consultant, nurse practitioner with certifications in women's health, so gynecology, and another certification in family nurse practitionery, which is basically general medicine or lifespan medicine for all genders. So something I'm really passionate about sharing with my patients that I don't have time with everyone to talk about is why IUDs are always recommended by so many different women's health providers and gynecologists. So you may be wondering, why does it seem like more than half the doctors and nurses I talk to about birth control are trying to get me to use an IUD? And the reason for that is, well, number one, let's make a list. So I can think of 50 if you give me some time, but I'm just gonna go off the top of my head. I'm gonna say number one, can't see. Number one, effective. And again, please excuse my doctor handwriting. So IUDs are the most effective birth control. They're gonna be 99.9% effective. So when they're placed right and when they stay in place, and they almost always do unless you have an IUD placed right after birth, then sometimes it could come out later. But the IUDs, they're really foolproof. So the other birth control methods aren't as effective, and by effective I mean preventing pregnancy and many other health benefits, such as reducing the amount of blood that someone has with their period every month. So people that have really rough periods where they're bleeding a ton, the hormonal IUD can really help with that. And if someone wants to prevent pregnancy, it's super effective. It's the most effective because there's no room for user error. So number one, the IUDs are super effective. I'm gonna show you my IUD here. This is what an inserter looks like. So this is not the IUD, don't worry. But this is what we use to insert an IUD. And another thing to not worry about is that we don't put this whole thing into the vagina. That is not what happens. So what we do with an IUD inserter, this is one type, there's multiple different kinds out there, but for like a levonorgestrel IUD, a progesterone IUD, such as Mirena or Skyla, Kylena, something like that, and I don't get any kickbacks for endorsing them. I just, as a healthcare provider for women and folks of gender minorities, it's a great tool that we have. The IUD is just great. It makes people happy and it makes their lives better. So with this, we use this little guy here to measure how far we want to insert this. And the reason we do that is because we never want to use this tool in a way that would hurt you. So we would never want to put it in to the uterus too far, because it could technically get into the lining of the uterus in a way that we don't want. A medical term for that is perforation. Scary word, so I try not to use it. It's not as bad as it sounds. It's never good to do something unintended, right? But the perforation of the uterus, it's typically not a life-threatening issue. So then, sorry, someone's doing a wheelie out there or something. So after we measure, then at that point we can insert it. And we want to make sure that we don't insert it too far. We insert it in just the right place in the uterus before we release the top part of the IUD to make sure it's in the right place. So you can be reassured that it's placed properly. And this is what an IUD looks like. This is my little keychain that I use in my clinic to show people. So it's pretty small, as you can see, and this is what's inside the uterus. The uterus isn't very big. It's just a little bit bigger than this IUD. Now, a pregnant uterus is huge, right? But a non-pregnant uterus is going to be pretty small. So we put that in the IUD, and then these strings are about this much is going to be extending outside of the cervix, so that the bottom part of the vagina. So where was I going with that? So user error. So it's very effective because it's hard to mess this up, because you don't have to remember to like put in and take out your IUD every day, and because it's like a set it and forget it type of thing. Once you get it, you're good for anywhere between 2 to 7 years, depending on which IUD you get. Ask your healthcare provider. They're always changing it too, but it's something that you just can set and forget, and which is really nice if you're planning on preventing pregnancy, because this is something you don't have to remember to take a pill every day. It's not something that's going to cause ongoing large amounts of irregular bleeding. There still could be some bleeding, some spotting, but over time it's going to be less and less. And half of the people who use the IUD lose their period altogether, which is healthy and safe. Check out my prior videos about why it's okay to not have periods if it's because of an external hormone placed in the body. So aside from being 100% effective, because there's no room for user error, because it's something that's just in there and you can forget about it for some years and live your life, but also it reduces bleeding. And again, that's not for everyone. So the point of my video here is not to, it's my graph. Number 2, reduces bleeding. So my point here is not to convince anyone of something that they don't want to do. So if you're already like, nope, don't want the IUD, I heard a scary story from my sister or my friend, not for me. I'm here to kind of, to help you if you're on the fence of deciding, should I get an IUD, should I not, why it's good. And the reason why lots of your nurses and doctors suggest it. We're not suggesting it because we don't get kickback from recommending it. It's not like it's something that's easier for us. Actually, putting an IUD is going to be the hardest way of providing birth control for most healthcare providers. A lot of doctors and nurses, nurse practitioners, physician assistants, so advanced clinicians who treat patients, a lot of them are not trained in how to insert an IUD. So it's often going to be done at the gynecologist office instead of your primary care provider's office, which is unfortunate. That makes it kind of inaccessible. It's not a hard procedure. Most patients and providers do well after the providers had some training. But the reason that a lot of people suggest getting this, even though it's actually harder in some cases for the healthcare provider to give it to you, is because not only is it effective, but it reduces bleeding, which is a complaint for 5 to 10% of patients who come in. So 5 to 10% of people with the uterus of reproductive age. So generally that's going to refer to women between the ages of, let's say, 16 to 50, more or less. 5 to 10% of those people are going to experience at some point in their life too much bleeding. So that's defined in clinical terms in like milliliters or the amount of pads someone uses. But in my book, any person, any woman, any patient who tells me the amount of blood that they have is too much, I believe them, no matter how much that is scientifically in a measurement. If they say it's too much, it's too much for them. And we have this really safe and effective way, such as a hormonal IUD, that is going to reduce the amount that the person bleeds every month, almost guaranteed. It's going to at least a little bit stop some bleeding or make it lighter. And again, like I said, for half of people, it totally takes the period away and all bleeding away after 6 months of the IUD being in place. Now, keep in mind that does not apply to the copper IUD. That's the non-hormonal IUD, but just the hormonal IUD. It's going to help reduce bleeding. The copper one, it actually increases bleeding. So if someone has heavy periods and they don't like that, I tell them don't do the copper IUD unless you're open to having it maybe make the bleeding worse, which can lead to other health issues. So in addition to being effective and regulate your bleeding or reducing the amount of bleeding, it's also, number 3, safe. It's super safe. Now, why do I mention safety? Why do I bring that up? You might be thinking, well, are you saying that other birth control methods aren't safe? And the answer would be yes and no. So if you use a progesterone only contraceptive, so like a hormone like an Nexplanon IUD that goes into your arm, or if you use the Depo shot, which goes into your arm every 12 weeks, or a progesterone only pill that you take at the exact same time of day every day, mini pill is another term for it, those are relatively safe. But when we're talking about the most commonly prescribed method of contraception or birth control, hormonal regulation for reproductive age women, that's going to be, Alexa, stop. I have 17 reminders every day because I'm just doing too much stuff. clinic work and my YouTubes and all that. So back on track. So the most common type of birth control being the combined pill. So that has estrogen and progesterone in it. And estrogen does increase the risk for blood clot, for stroke, heart attack, liver problems. Very small risk, but that risk becomes bigger and scarier for women that have other underlying health issues. So if you have a history of like a deep vein thrombosis, a DVT, and you're diabetic and you have high blood pressure and you're 45 years old, you would be somebody who I would really worry about being at risk for the health issues I just named and more on a birth control pill. So you would be somebody who I would recommend the safer method of regulating your periods, reducing bleeding, or providing contraception, so preventing pregnancy. You're someone who I would recommend getting a hormonal IUD because it's locally acting and it doesn't go throughout your whole body and there's no estrogen. So a lot of people will ask, well, can I get like a low dose birth control? The IUD, this is gonna be your friend. This is it. Because it doesn't, you don't put it in your mouth and swallow it, which then goes through your stomach, goes through your liver, goes to your entire bloodstream, and is a higher concentration of hormone. This pretty much just acts within the uterus and the cervix. So in that, the area that it's in, it's the hormone gets to, but and yes, the hormone will still make its way into the bloodstream, but in much smaller amounts than, let's say, a birth control pill would, which, and again, there's 2 hormones in a birth control pill. There's just one in this. So no estrogen in any IUD. There's no IUD that's made with estrogen, which is the hormone that comes with more health risks. So it's safe. So the top 3 reasons it's always recommended, or often recommended, is that it's effective, reduces bleeding, which treats so many different health issues for women like anemia and job issues from having to change a pad all the time, emotional, mental distress from a ton of bleeding, et cetera, et cetera. The list goes on. And number 3, it's super safe. Safe to insert it and safe to leave it in, even if someone's sexually active with a lot of different partners and someone who gets a lot of STDs, no judgment. But there's an old myth out there based on older IUDs that someone who has a lot of STDs is gonna get a uterine infection because of the IUD, with the thinking that the bacteria from the infection would travel up these strings. Sorry, I'm trying to give you an accurate representation. That would travel up these strings through the cervix into the area of the IUD and infect the uterus that it's in. That's based on older, more crappily made IUDs, if you will, that had like a really creepy braided string. This one is just one filament. It's sanitary. The ones that were in the 70s, people did have uterus infections because of that older type of string and the way it was made. And there, among older health clinicians and doctors, there's like this persistent idea that someone who has a lot of sex shouldn't get an IUD. False. That's I would say the opposite, really. If someone has a lot of sex, particularly heterosexual sex, like penis and vagina sex, they should have an IUD, because unless they want to get pregnant, then of course don't use one if you want to get pregnant. But it can be a great tool to use in between babies. So for family planning, if you know that after your first kid, you want to wait 3 years till you have your second kid, IUD is great for you. If you're someone who wants to have a strong career and you're 25 and you know that you don't want to have kids till you're 35, IUD is a great option for you. There's just so many scenarios I can think of that make the IUD a great option, and I'm not paid to say that. I speak from a perspective of working with hundreds, thousands of women of all different ages, and people of other genders that have a uterus, who like really just love their IUD. I'll make another video about common myths around the IUD to focus in on like the concern for infection that as a myth I would like to debunk. And something my patients also ask me all the time is it gonna hurt too much? I heard it was awful to put it in. Everyone's different, and I would say no matter what type of procedure you ever have done in your life, know that you're in charge of your body, and you have the right to always ask to be told everything that's going to be done before it's done, You have the right to say no at any point, and you have the right, once something has started, once a procedure is in the works, you have the right to stop that at any point because it's your body. So that's just kind of a separate topic, but I know that not all healthcare providers practice that way, in a way that demonstrates great respect for one's body and ability and recognition for it being okay for someone to change their mind. But I think that's a starting point. Is, again, something you see in a lot of my videos is just being a self-advocate. And if you don't want an IUD, just be clear with your healthcare provider. Like, if you see a gynecologist who's always telling you, like, just get the IUD, that's the greatest method. If you know that you don't want that, totally okay. That's your informed decision. You've done the research, you've asked for information, you decided it wasn't for you. Definitely express that to your provider and say, hey, I don't want this. I'd appreciate it if we could spend the rest of our visit time talking about a different type of birth control method. And that will be really good, clear communication for that provider. You could even ask them to document in the chart that's not an option that you would like to talk about for whatever reasons that you have. So again, to wrap it up, a lot of healthcare providers recommend the IUD because it's effective, it regulates your bleeding, reduces bleeding, and it's super, super safe, which is something that we all want for our patients and ourselves. Like, I want to use a medical device or treatment that's effective and is going to reduce something that may be bothersome to me and be super safe. And again, I'm specifically talking about the hormonal IUD in this presentation and showing you the inserter for that hormonal IUD, or Mirena, other brand names for it. But I'll probably make a separate video on the copper IUD too. There's a lot of similarities. It's just as effective and just as safe, but it does not hit point number 2 of reducing bleeding. It actually can increase bleeding, which for some people is okay, some people not. And yeah, so that's basically it. Nurse Cat Pink signing out. Thanks for watching my video about IUD, the hormonal IUD, and why it's commonly recommended, and listening to me talk about stuff that I wish all of my patients knew and had time with me to talk about, but usually your doctors and nurses just don't have a lot of time to talk about stuff with you. So it's great to inform yourself on these things, and definitely hit the like button if you like this video, and leave me a comment to let me know what else you'd like to know about, what else you wish that your gynecologist or doctor would talk about, and I can provide some helpful support and information on that. All right, Nurse Cat Pink signing out. Take care.